So I think we're going to get started. We've got almost 50 participants. I hope everyone can hear me. So hello and welcome to the School of Cities Affordable Housing Challenge Project's first ever Zoom seminar on homelessness and COVID-19. I'd first like to begin by saying a big thank you to everybody for taking the time to virtually be with us tonight. I think, do we have around, yeah, we have around 50 people so far. There'll be more trickling in. So I have no doubt in my mind that our seminar will spur nothing short of engaging and insightful discussion and debate. I know you all came out to hear from our panelists, but before I pass it on to them, I'll briefly introduce myself and then quickly go over what the School of Cities Affordable Housing Project is. So my name is Natasha Cheong. I'm a PhD student in the Geography and Planning Department at U of T. I'm also one of the research coordinators for the School of Cities Affordable Housing Challenge Project. I'm very excited to be moderating this evening's event, pardon me. Since before attending graduate school, I worked and casually still do in Vancouver's downtown east side, providing frontline outreach social supports to individuals and families grappling with mental health concerns, addictions, and homelessness. And throughout my years working in homelessness services, I've seen the devastating impact that the housing affordability crisis in both Vancouver and Toronto has had on vulnerable populations. And given our current state of affairs, there's no better time than now to learn about and discuss the critical perspectives on homelessness and COVID-19. So tonight's seminar is part of a bigger series of seminars run through the School of Cities. And for those of you who don't know, the School of Cities is an interdisciplinary urban research, education, and engagement center that has several urban challenge projects, with the Affordable Housing Project being one of them. So it's no secret that Toronto is experiencing an affordability crisis. So on our end, our project's vision is to bring together folks from U of T and the community to have a critical discussion on how to move forward towards ensuring inclusive cities where everyone, regardless of their socioeconomic status, has the choice to live in a safe, adequate, and affordable housing in Toronto. And we do this by having faculty and community housing meetings throughout the year, along with the seminar series, including tonight's event. We also are writing a white paper report and have a blog site in an effort to disseminate as much academic information to the public so that we can all make informed, evidence-based decisions to help create the type of city we want to live in. So without further ado, I'll introduce our panelists, whom we're so grateful could take the time out of their busy schedules to be with us tonight. First, we have Dawnmarie Harriott, who as a graduate of Voices from the Street and now the coordinator, shares her personal experience of fleeing abuse, falling into poverty, and housing obstacles to educate the public to hopefully remove stigmas and misconceptions and create social change. Dawnmarie firmly believes that people with lived experience of all forms of marginalization should be included in research and service provision. Next, we have Emily Paradis. So Emily has been an activist, researcher, advocate, and frontline service provider on issues of housing and homelessness for 30 years. Her scholarship and practice aims to support marginalized communities in claiming spaces and rights to the city. She's a sessional instructor in the Urban Studies program at Innis College at U of T, a Maitrey Fellow, and a member of Right to Housing Toronto and the National Right to Housing Network. Having never experienced homelessness, she relies on the insight generously shared by colleagues with lived experience and expertise. Unfortunately, we also had another speaker, Joe Hermer, who is an associate professor in sociology at the University of Toronto, Scarborough. However, due to an unforeseen emergency, he's unable to make it tonight. But before we dive into the seminar, I'll give you a quick layout of the evening's agenda. So we provided the panelists with 3 questions, which we'll post via screen share. However, given the online platform presence, please feel free to ask questions throughout the discussions. You can either send myself a chat or Lauren March, or if you want, you can just send it to everyone. And also, if you miss anything, don't worry. We'll be recording this, so we can send it around when it's available. All right, so if we can post the first question. Thanks, Sean. So the first question is for Emily and Dawnmarie. What key challenges are emerging for homeless Torontonians as a result of COVID-19?
Thanks, Tash, and I'll jump in there. First, I just want to do a mic check, making sure that my headset is working okay. Just Sean or Tash, if you can give me the thumbs up if my sound is okay.
I can't hear.
You can't hear? Uh-oh. Okay. Can you hear me better? I don't know. Sean, can you hear me?
Yes, I can hear you.
I see folks in the chat saying they can hear me. So thank you for folks in the chat. Good participatory use of the chat. Keep it going. So thank you so much for hosting this really important conversation. And I also just want to say first that I'm extremely honored and grateful to have the opportunity to share this virtual space with Dawnmarie. And also I just want to acknowledge that I am entering this virtual space from the physical territory of the Huron, Wendat, Seneca, and Mississauga peoples, and the territory governed by the Dish with One Spoon Wampum Belt Covenant, which is a covenant between the Haudenosaunee and Anishinaabe peoples. And as a settler here, I'm very, very grateful to have the opportunity to live, work, and meet with others in this space. And I think it is really important to situate myself and situate ourselves as we enter into these conversations, because of course, homelessness is absolutely a question of space, a question of urban space, and very much a product of colonial relations on this territory and in this land. So to go to the question, which I think is such an important one, what are the key challenges that people experiencing homelessness are facing as a result of COVID-19? You know, when the epidemic began, I think we can all recall that the very first directives that everyone received were stay home, avoid contact with people from outside your household, and wash your hands frequently. Those were the three key directives. And it's really obvious that for people experiencing homelessness, all three of those directives are impossible. So that was an immediate and very, very important challenge that folks were immediately facing. To break that down, we know that shelters, especially congregate settings, which most shelters in Toronto are dangerous and pose an elevated risk of COVID-19 transmission. And we've seen that with large outbreaks in Toronto's shelter system, more than 600 cases of COVID in the shelter system, and at least 6 documented deaths. Folks facing homelessness, though, encountered a number of other challenges that might not be quite as obvious, one of which was the closure and reduction of services and spaces that people rely on for everyday survival, everything from drop-ins and meal programs to libraries, even shopping malls, places that provide in the cold, dreary days of March and April some shelter from the cold, crummy weather, and then in the hotter weather, spaces that provide access to a cool space. As well, the lack of access to washroom facilities and other types of basic sanitation, and lack of internet access and hotspots. So all those kind of commercial and community based facilities that closed down, shops, cafes, libraries, community centers, all play a really important role in for people who are sustaining themselves from day to day without a home, and those were closed. Another aspect was the loss of informal income. So folks who rely on panhandling, on salvage, on busking, on sex work, all faced really sharp declines in their income, and of course did not qualify for income benefits that were made available to folks who have more mainstream types of employment. We know also that being in isolation put people at much higher risk of overdose because using alone is more dangerous, and because, again, there was a lack of facilities and safe places for people to go and to be in the company of trusted friends and community members. And a very, very visible issue that has become more and more kind of prominent in the discussion is folks forced to live outside. People who are moving outside, some of whom for the very first time, because they don't feel safe in the congregate shelter system. Some who are outside because the shelter system is absolutely packed, and people are facing long waits of days at a time before they can even access a single bed. And an increase probably in the number of people needing shelter in Toronto as a result of a number of factors, one of which is the discharge of people from provincial institutions, health institutions, detention centers, without adequate discharge planning and without a home to go to. And so I think everybody who's on this seminar right now is probably aware of and has seen an increase in the visibility of tent encampments, people camping on their own or in groups in public spaces at a level of visibility that we haven't seen before in Toronto. And people I've talked to have pointed also to the lack of information and lack of clarity about what services and supports are available for folks facing homelessness. It's just really hard to get information at a time like this for anybody. But with new programs being announced and new benefits and new services and stuff happening, it's been really challenging for people to keep up with that and to even know what kinds of resources and supports are available to them. For people living outside in encampments, we've seen really dire situations. Encampments lack access to fresh water, to drinking water, even those in public parks, because the park water fountains and washrooms have been closed down. People haven't had access to basic washroom facilities, to sanitation, and other just really kind of basic fundamental human needs and human rights that people haven't had access to. People also face the threat of displacement when they're in encampments, enforcement of the city's anti-camping bylaw, and being moved along by police and bylaw officers. And this creates a lot of disruption for people. It displaces and disrupts sort of street families and communities that have come together. And it also kind of forces people to move farther and farther away from the services and supports that they rely on. Now, all of that being said, I do want to point to some positive things in relationship or as a result of COVID-19 that I think are really important for this conversation. We saw a level of responsiveness that we have never seen before. The city's shelter system has been operating basically at capacity since statistics started being collected about that. And we saw really, really rapid response on the part of the city to expand space in the shelter system. We've seen people moving into housing out of the shelter system and out of encampments at an unprecedented rate. I think the last number I heard was that 1,300 people had moved out of shelters and encampments into permanent homes. At the beginning of the pandemic, we also saw a moratorium on encampment clearances, which meant that folks who had been getting moved along and dispersed by bylaw could rest easy, knowing that they weren't going to have to pick up all their belongings and find another place to settle. And for a lot of people, that meant a lot of peace of mind in the midst of what was a really, really stressful time. We saw a moratorium on evictions. The provincial government actually stopped the sheriff from carrying out evictions and stopped the landlord and tenant board from issuing eviction orders, which meant that tenants who were precariously housed could stay in place. And we saw income benefit programs that were easy to access, that didn't put up a million barriers, and that were rapidly delivering the income that people needed to survive. So that kind of rapid program and policy change and that urgent response to homelessness in response to COVID is something that I really hope we can build on. And I think it's something we need to keep in the picture when we think about what the challenges have been.
Emily.
Do I just jump in?
Sure, Dawnmarie, yeah.
Excellent, okay, thank you. So I normally speak from a lived experience perspective, and I usually incorporate personal stories within my talk. I just wanted to share before I begin and answer the question that in my experience, this has created stigma and discrimination, especially around landlords that Google me, in terms of saying I'm living in poverty, even though these stories were years previous. So I tried to combat that with doing a rags to riches story, but that still doesn't necessarily work. So including race into this, I need to be very careful. But in saying that, this topic is very, very important, and I just knew I had to be here to talk about it. And I'm just so grateful to be invited and to share my views. So in answering the question, I'm going to answer from a racialized view. And new data shows that Indigenous, Blacks, and other racialized communities are overrepresented in Toronto neighborhoods that are hit hardest with COVID. Social determinants of health, such as race, income, housing status, has always been determined who gets sick and who stays healthy. And the virus is actually making that more visible now. And we have heard data and stats that Indigenous and Black Canadians are dying at a higher rate. This can come to overcrowded units due to affordability. This doesn't allow people who get sick to actually be able to isolate. Inadequate housing, one of the things I'm really hearing, I've created through my work, Working for Change, a support group for women. Well, it turned out to be only women, but hearing their stories, talking about illness, respiratory illnesses due to staying in moldy basements all day, every day. Usually people are out and about, so that's happening. A rise in mental health issues due to isolation, and exacerbated health issues such as diabetes, high blood pressure, with minimal access to family physicians. There is access, but a lot of times we have to call the family physician, and it doesn't necessarily, a lot of people are feeling that it's not like coming to see the doctor, it's a different feeling. I know Emily talked about not evictions during COVID, but there is a worry now because of Bill 184 that people have to make arrangements with their landlords, and maybe their landlords won't agree and feel that they may be evicted due to not being able to catch up on the rent. One of the things that I have to say that personally hit me really hard and that we need to talk about is the climate, the current climate, especially since George Floyd's death and being isolated and having these images on social media, but also it's not just one incident, several incidents keep happening from previous to COVID to after COVID, well, during COVID, which it was after, but during COVID. And it really takes a toll when there's limited services, especially cultural perspective services, and then we are left to talk to family, friends, and colleagues who may be going through the same things or may not be able to support us through that. And I'm finding that that is a really big effect on the racialized community. And so I think we really need to address those issues and look into it. But I'm lucky to be able to sit on a board, the board of Across Boundaries, an organization that provides mental health services for racialized communities for the last 25 years. And so I'm able to get support there. And while I said I was hit pretty hard, I've been able to use my tools and my supports to be able to now turn around and support other people going through isolation and these issues. Thank you.
Great. Thanks so much, Dawnmarie.
Mind if I just pick up on a couple of things, Dawnmarie? I really appreciate that that perspective, and I wanted to just add that looking at this through an intersectional lens is so important. And in addition to being overrepresented in overcrowded and poor quality housing, you know, of course, we also know that people who are Black and Indigenous and people with disabilities are overrepresented in homelessness in general, and particularly among people living outside in Toronto. There's a huge overrepresentation of Indigenous people. So Indigenous people account for about 2% of the city's population, according to the census, and there's all kinds of problems with census taking for Indigenous peoples in any case, but that's the number we've got. Whereas the city's street needs assessment identified that 38% of the people who were living outside were Indigenous. So that's a huge overrepresentation. And so for sure, when we're talking about overcrowding in shelters, when we're talking about people in encampments without access to basic water and sanitation, that is people who are Black, people who are Indigenous, and people with disabilities.
Great, thanks, Emily. That actually segues into the second question very nicely in terms of what has the city done to respond to these challenges? And can we understand these challenges and recent responses in relation to historical policy choices in the city?
Okay, so I think declaring racism as a health crisis was a very big step. Hopefully that will look at the services that are really needed from a cultural perspective. And while race-based data collection around COVID is starting to happen, Canada is a little bit behind. And the initiatives, I feel, well, we feel should have started when the pandemic started. Toronto has been collecting some data on race and impact, but only some of the overall stats have been released. And so we're waiting for other stats to be released, and we're looking for new ways of collecting data as well. Recognizing the structural racism and speaking up on it. I know I've heard it in years before, but I don't know who said it, but I have to say when Doug Ford said there was no racism in Canada, a lot of us was really taken aback. And I know he retracted his statements, but it was quite hurtful. And I have to say, people like Joe Cresci and the NDP are talking about the issue and acknowledging that it's there. And I think we all need to do this in order to combat it. while Toronto is providing quarantine accommodations for the homeless population in terms of hotel rooms, I've been speaking to some people in the shelter systems, and they've really, as Emily mentioned, they've really reduced their numbers and are accommodating people to stay in hotel rooms. But for racialized communities, we'd like to see that happen in terms of, as I mentioned, overcrowded units. If you get sick, you can't isolate. There's nowhere to go. And so there's a risk of spreading the virus. The Toronto Board of Health has approved that all 3 levels of government to fund voluntary quarantine spaces for racialized people has been approved. But this was modeled from something happening in Chicago and New York. But the 3 levels of government has yet to commit to that. So that's something that I think would help minimize the spread and help with the isolation, but also help with accommodating people in the racialized community. Emily?
Thanks, Dawnmarie. And just to again build on what you're saying there, I think the connections you're making are absolutely key for folks to understand. And I know often when we use the word homeless, there's a certain picture that comes to people's minds, and it's usually, you know, an older white guy on the sidewalk, or there's a specific kind of mental image. And there's a specific type of experience that people think of when they think of homeless. And what's really important to understand is that homelessness takes a lot of different forms. And when people lose their housing, there are many different ways that people manage and survive in that situation. And especially for women and women-led households, and particularly for women with children, for example, that usually looks like doubling up and moving in with a family member, with a friend, with anybody, to be able to stay out of shelters and off the street because of the risk of child welfare attention and intervention, because of the risk of violence. Likewise, for many racialized communities, dealing with loss of housing is not as much about turning to shelters as it is about turning to friends and family and community members. And again, doubling up, living in closer and closer quarters.
And if I can you just made me think of the domestic violence. This is not necessarily racialized, but it's something that I think needs to be said. Is on the rise. It is, I don't know if you've seen the stats around it. It is just, I don't even know the word for it right now, but I've been speaking to some women and I'm in projects, and women are saying, you know what, healthcare is free, but I have no place to go. There's no housing, so I'm going to stay in this home. And that is something that, you know, we need to address as well. So just to put that out there.
Absolutely. I heard a statistic somewhere that I think there's been a 300% increase to crisis lines for gender-based violence. And absolutely. So again, that directive to stay home, for some people, that is trapping people in the situation where they face the most danger. And we do know that home is the most dangerous place statistically for women, particularly for Indigenous women. To return to the question, if it's okay for me to do that, and I think the question was about what has the city done, and how do we put that in the context of kind of the broader city policy and the recent history. And one thing that the city did was it very quickly moved vulnerable people out of shelters. And when I say vulnerable people, I mean people who were at particularly high risk because of COVID. And acquired hotel rooms and other spaces really quickly to move people into safer, non-congregate settings. Another thing the city did really quickly was set up an isolation facility for folks who were homeless, who were diagnosed with COVID, so that they could have access to safe space in which to isolate and recover. The city also had to expand its existing shelter system, so that the city's shelter system is made up of about 70 shelters, as well as some 24-hour drop-ins and respite centers for serving women and trans folks and other folks who are not well served in the general shelter system. And all told, there's probably about 8,000 spots in the city's shelter system. And the city had to expand that system into other buildings like community centers in order to get the physical distancing that was required. And it's really important to understand and to put in context the fact that the city's shelter system has been operating, as I said, basically at capacity for as long as those statistics have been collected. And so the need to urgently create space for physical distancing is, you know, part of that bigger picture of the city having this very, very overcrowded shelter system, and of failing to address that overcrowding. And the city also has looked at kind of new types of approaches in a way that I think has been really positive and has moved quickly on things that used to take a really long time. So I mentioned that about 1,300 people had moved into permanent housing from shelters and from encampments. That's an incredible number. I mean, I don't think we've ever seen a number like that in a 4-month period. The city also started doing things like, well, obviously acquiring or renting whole hotel buildings that were empty because of the impact on tourism. Using apartment buildings that had been slated for demolition as spaces to move people into. Fast tracking modular housing. And we now have approved 2 modular housing projects that are going to contribute 100 units in an incredibly fast time frame. They're expecting they'll be ready for occupancy by September because of the speed at which modular units can be constructed. So these are all really, really great things. And one of the things they show us is that government is capable of acting quickly when there's a sense of urgency. I think for a lot of people, though, that kind of cuts both ways, because for people who've been struggling and people who have been dealing with homelessness and inadequate housing for so long, there is a sense of, oh, now the city is taking quick action. And I don't want to just point to the city here. We should say all orders of government are suddenly taking quick action to house people, to provide income, to make sure everybody has health care, when there's something that threatens people who are better off, basically, right? But for the long, long time before that, in terms of people facing homelessness, people living with disabilities, people living on social assistance, that sense of urgency wasn't there to address those issues or to ensure that folks had the basic needs and an adequate standard of living. And I think it's also important to recognize that some of what the city has done has been actually in response to lawsuits. There was a lawsuit to force the city to implement the 2-meter distancing in shelters. And there has more recently been a lawsuit to stop the displacement of encampments. And I think it's really unfortunate that in the midst of a pandemic, people facing homelessness, people who are, you know, the most vulnerable, had to take the city to court to just enforce their basic human rights and their ability to keep themselves safe and healthy. And of course, it's really important, again, to make the connection between homelessness and the bigger picture of Toronto's housing crisis and the lack of affordable, accessible, safe, secure housing for folks. And that has a much, much bigger picture kind of background. And certainly that's not something that the City of Toronto can solve on its own. It takes funding and regulatory and legal and policy work at all three levels of government, and really from the federal government.
Great, thanks so much for that. I appreciate you bringing up the idea that, you know, how come the governments are able to act so fast now? Because that's been a common conversation amongst a lot of the talk within the homelessness services that I've been working in so far. So thank you for bringing that up. So our last question, if we want to pop the slide up, it is among challenges, oh, we'll wait for that. Among challenges that have not been addressed, which do you think are the most pressing? And how could we address these pressing challenges as a city?
Emily?
Okay. I think there's a few key things. First of all, a key challenge we're facing now is how do we hang on to the gains that were made in response to the crisis and make sure that we don't go back to the way things were. So you hear a lot of talk about going back to normal. And I think it's really, really, really important that we absolutely not go back to normal. We cannot go back to a normal where there's 8,000 people staying in shelters and respite centers every night, and tens of thousands more who are doubled up or living in situations of abuse. We absolutely cannot go back to a normal where people with disabilities and people who aren't employed are expected to live on rates of social assistance that are in some cases less than half of what the CERB offered to people. We certainly can't go back to a normal where racism is denied and where anti-Black racism is operating without being challenged at all levels of government. So to me, I think that's the challenge that we face now, not just the city faces, but all of us face as people living here, is how to make sure that we don't go back to that normal, but instead build on some of the positive developments that we've seen to move us closer to being a society where there is housing justice, where people do have what they need to stay healthy and to stay safe. In really practical terms, some of the challenges facing the city in particular right now are, for example, with the end of the eviction moratorium and the end of the CERB, both coinciding at the same time, how can the city help tenants maintain their security of tenure and stay housed? We know that a lot of tenants are coming out of this crisis with arrears in rent. We know a lot of people are also facing longer term loss of employment and loss of income. And there needs to be a plan that supports people to stay where they are, because as soon as people lose their housing, the unit they're in can be rented back out at any price the landlord wants. So every single person who's living in a unit right now that is somewhat affordable for people on low and moderate incomes, not only does that household losing their home create harm, but then that unit that they were in becomes an unaffordable unit. So that's an absolutely key piece. And another really key question is, how's the city going to make sure that everyone who was moved into hotels, everyone who was placed temporarily in individual units, has the opportunity to remain housed in the long term instead of sending people back into the shelter system. And that's really tough. And again, both those things are things that the city can't necessarily do on its own. It's going to need the contributions of federal and provincial governments. And at the same time, I think it's for the city to take leadership there and to push for that, and to make sure those things happen, and let those other orders of government come in to pick up the tab. And to make the connection with discussions on racism and policing right now, there's a huge proportion of the city budget that currently goes to policing. So when we're talking about defunding the police, when we're talking about reallocating those funds, that's one of the places where we can find the missing money that can help the city accomplish this goal of ending homelessness and making sure that tenants can stay in their homes.
So Emily, if I can just interject, regarding your comment about not going back to the normal, what do you propose the public can do to ensure that we don't go back to normal? And do you have recommendations?
Absolutely. I mean, I think that just speaking out and being visible and staying visible is really, really key. And I think that now is the time to be kind of vigilant. I think we're all relieved to, be able to walk down the street again. I mean, I know I take a lot of pleasure. I live in the Bloor and Lansdowne neighborhood, and it really gladdens my heart to go out of my house, walk up to Bloor Street and see people sitting on the street, literally, and having a drink together, enjoying each other's company, and that the small businesses in my neighborhood have mostly survived. Like, that really makes me happy. And I think this is a moment when we all want to feel a certain sense of relief. And at the same time, we got to stay watchful and make sure that we're continuing to communicate that same sense of urgency. Governments didn't take action just of their own, largesse, even in response to the crisis. And a lot of the interventions that came in response to the crisis were in response to a lot of public outcry and people making sure that governments knew what they needed. And then I think there's also a lot of things that we can all do for and with each other. One of the coolest things that came out of the pandemic was the mutual aid networks that happened in neighborhoods, and the ways in which people began to find ways to support each other without needing kind of outside intervention, and having that kind of self-determining, autonomous networks continue as a way to build new kinds of community, I think is also really key. Dawnmarie, I've been talking a lot, so.
No, that's fine. You talk as much as you want. Yeah, this is great. I guess the government has stepped in, but I'm in a fearful place because I'm worried about the coming months I think homelessness is going to rise, especially what you were speaking about in terms of the cost of housing. I myself have been working in the same job for 13 years, but I pay 50% of my paycheck of my monthly income to my housing. And that in itself is close to homelessness. If we really think about it, it should be no more than 30%. And then we're going to look at things, if people are evicted, that's on their records. We're looking at especially racialized community and before it was much easier to rent an apartment. Now they're looking at credit checks, job letters. You have to have like the highest or guarantors or things like that. And I think that's going to be difficult coming up. And I think, as Emily, you said, the city can't do this and it has to be all levels of government, but we have to not just put people back into shelters, but we have to look forward to how do we bring down the cost of the housing market, but keep looking into providing more and more units in housing, affordable units. Also, a lot of Black and racialized people face, there's an issue with employment, but with stereotypical names. They don't get callbacks from their applications or for job interviews because of based of their names. And then there's no benefits or drug plans that people can rely on. And then stuck in only low quality housing, as I mentioned before. And it's, as you mentioned, Emily, speaking up, recognizing there's a lot of things that people don't recognize, the divide between housing, employment, and healthcare for the racialized community. And my anxiety goes through the roof when I'm looking for a place because I know I'm going to be faced with it. I deal with racism on a daily basis. There's some things that I know I can't fight every single situation. People will come up, oh, I like your hair, and touch it. What gives you the right to touch my hair? I'm my own person. Those are things that I'm not going to fight, right? Once I'm looking for housing, it affects me in terms of I usually bring a white person with me when I'm looking for housing. And the reason I do that, it's almost to say, no, I'm not just isolated in the Black community. And that's the internalization that I put on myself, but it sometimes helps and it sometimes doesn't. I've been to renting a place where somebody has come with me and the landlord thinks they're renting, and blatant racism that I face is when they realize I'm renting, they don't even look at me, they don't want any information from me, they just basically say no. Also, there's times when it's not so blatant, but I'm saying I'm coming over to look for an apartment. My accent is not a Jamaican accent, even though I was born there. I can put it on, but usually I don't use it in that setting. And but when I arrive to the unit, they'll say it's already taken, and I know it wasn't. So those are the things that I face, and I think we need to recognize that even in the healthcare, there's different treatment for the racialized community, and I can go into detail, but not really right now because we're not really talking about healthcare. But we need to collect more data around the areas of the social determinants of health, employment, housing, and health, and recognize that there's a very people are being left out on the margins. I have some notes, but I've lost my space. So I just think that even though we need more data to combat these things, data is not the only thing that we need. As I said, we need to speak up, we need to recognize, and we need to try to do our best to create social change in our communities.
Great, awesome. And so, Dawnmarie, I guess a similar question in terms of enacting or creating social change. For us or the audience members, do you have recommendations on what we can do to support that or to catalyze it?
Okay. I do. I think what's happening around the world, especially and in the city, is that people are recognizing, people are standing up, people are supporting racialized communities and understanding that it's disproportionate. These are things that I've known all my life, but because of social media, people are seeing it more. So I think, being allies, not just allies, not a verb. I mean, it's not a noun, it's a verb. So we have to do action. We have to join those committees. We have to bring people with lived experience on committees to shape to shape policies, include us in discussions, in service provision, but also when being allies, just joining campaigns and things like that people can support each other, support the community, so that we don't feel so isolated and alone. I hope that answers.
Yeah, no, collective action sounds like the key kind of driver to move forward. So thank you for that.
Dawnmarie, I just want to tag on to what you said there about making sure that people with lived experience and people who are directly affected by policies are at the table and making the decisions about those policies. I think that's so key, and I really appreciate that you raised it. And one thing that happened in the midst of COVID was that some of the mechanisms that are in place to enable the city to make sure that it is getting the benefit of that expertise of people with lived experience and people who are directly affected, and sort of being accountable to those communities. Those bodies were kind of put on hold. So for example, the city has a poverty reduction strategy, and it has an accountability table of people who are experiencing poverty, who provide input and really important advice and guidance on policy, and who are part of making decisions. But those types of committees and bodies and places that folks have had some opportunity to influence policy in the past weren't operating in COVID. And I think for a lot of people, and as an ally, that was a real lost opportunity. And the city has passed a housing plan, a 10-year housing plan that is based on a human rights approach to housing. And I think that's a huge, fantastic opportunity. And we could really see Toronto make serious changes in the next 10 years if it really follows the spirit of that commitment to the human right to housing. But one of the key things that starts with is making sure that people directly affected have the opportunity to not just participate, but to take leadership in making policies and programs. So there should have been people facing homelessness and people who are members of communities that are directly affected as part of the city's emergency operations response table, as part of all the community tables that we're meeting with community service providers. You know, there were all kinds of new bodies that were created to respond to the COVID crisis. And to our knowledge, very few, if any, of those included members of communities directly affected and included people with lived expertise. So that's a key thing that the city needs to do going forward, is to make sure that as we plan the recovery, as we plan the rebuilding, the people who are facing homelessness and inadequate housing are part of those conversations. And I'm just going to drop into the chat.
Sorry, before you do that, I just want to tag on to what you just said, and it's challenging sometimes to remember we have to think in different ways now because of COVID. And I really like that what you said, because we have to recognize that, you know, in the rush of everything, people are putting Zoom calls together and things like that, and maybe not being able to connect with people. So just like this initiative, I was reached out to. So there are ways that we can do it and see who's in the community, do a little research, who's in the community to talk on certain issues. So thank you for pointing that out, because even in myself, and I've been saying for years, you know, we need to be at those tables. Well, we can't be at those actual tables now, but there are ways that we can contribute as well.
Absolutely. And I've just dropped into the chat a link to a recent report that I had the privilege of supporting the work on, and it's a contribution to the Toronto Office of Rebuilding and Recovery consultation process that comes out of a roundtable and conversations with a group of people with lived experience of homelessness and housing need. And it's basically their kind of direct input into what needs to happen from a policy perspective for the city's recovery to embody housing justice. I also wanted to mention, because someone had asked about campaigns and demands that housing justice movements are pushing for. So just to note a couple of pieces. One is around the issue of encampments. There is an encampment support network that has formed, and that's an organization you can follow on Twitter. and get involved with if you're interested in supporting encampments. It's very, very important for the city to hear from housed people that people in encampments should be allowed to stay where they are and should be provided with the fundamentals and necessities of life, including fresh drinking water, sanitation, access to washrooms. It might seem outrageous that we're, it's 2020 and it's the city of Toronto and we're having to ask the city to do this, but it's the city's duty to provide those basic infrastructures for every single resident of this city. And the city also needs to make plans with residents of encampments about what housing solutions will work for them. It can't make those decisions on behalf of people, and it can't come in with an enforcement approach and just push people out. And there's an excellent report that I'm putting in the chat that is a new national human rights protocol on how cities should respond to encampments. So again, just communicating to your counselor that you want to see people, treated with respect and dignity and have their basic needs fulfilled. That's a really powerful message. And someone's asking, what was the Twitter? The name of the network is Encampment Support Network. And so there's ways to donate and support their work, and they're doing advocacy work, but they're also doing direct support as well.
Thanks, Emily. There's also another question in the chat about what's going on with the youth demographic. So can you speak on how the young adult age 18 to 30 demographic specifically have been affected by COVID in the context of homelessness? And do you have any recent stats on this?
Dawnmarie, is there anything?
No, I did come across stats and everything, but I didn't include that, so I don't have that on the top of my head, but yeah.
I have to admit that I don't have statistics on that off the top of my head either. There's some stuff I've been hearing. One is, similar to what I was saying earlier with regards to the conditions of overcrowding in shelters and the dangers of congregate settings. Those apply obviously to young people. One thing that we know is that loss of employment and loss of income is really, really high among young people aged 18 to 30. That is the demographic that's facing the greatest impact on incomes, and especially women within that demographic are facing huge, huge loss of income and employment. And so that's likely to have a really negative effect in the longer term for people's housing stability and housing security. In relationship to encampments as well, I think a lot of, certainly by no means all, and I don't even know if it's a majority, but I know that a significant number of people living in encampments are young people, and they're facing that added stigma and policing at the intersections of their race, their age, and young people who are facing homelessness are also often queer or trans or two-spirit, and so they're facing that many layers of stigma and discrimination on the basis of all of those factors.
There's a question in the chat I don't have an answer to, but I'm very interested in this topic as well. It's from Jeffrey around creating barriers for homeless people, putting, with all the new bus shelters, they put an arm in between the benches so nobody can sleep, or how like downtown there's a lot of spikes on the buildings so people can't sleep in certain places. They're asking if we know anything that they'll be stopping this kind of practice. I don't know if you know, but that's something that I hope is stopped, but I do not know.
Yeah, And
Yeah.
it really raises this really important question that I think COVID has kind of underlined for us, you know, that idea of like, we're all in this together. We all heard that early on. And I think it quickly became apparent we are not all in this together. And in fact, what COVID did was it really exacerbated the existing divides. But when we talk about public space, who's the public we're talking about?
Mm-hmm.
You know, when we talk about public health, who's the public we're talking about? And if the city is really serious about public space, and it should be, there has to be recognition that the many uses and kind of appropriations of that space that people make have to all be understood as necessary and valid. I know if Joe Hermer were here, he would be talking about neo-vagrancy laws across Canada and the ways in which cities and towns and provinces, in the case of Ontario with Safe Streets Act, have laws in place that criminalize homeless people's presence in public spaces. And those are accompanied by those exact types of measures that Jeffrey is talking about, putting benches on the arms on the benches in parks and in bus shelters, other types of ways of making public space harder and harder for people to get comfortable in and inhabit. And there's bylaws against camping, against pitching a tent, against blocking a sidewalk, and a whole list of other things, against urinating or defecating in a public place or in the street. But if you don't have access to a washroom, what are you supposed to do? The human body has certain needs, and this is kind of what human rights come out of, right? Is what are our fundamental needs as human beings, as embodied people? We all need to sleep. We all need to piss and shit, I'm sorry to say, and eat. And when people are deprived of the ways and means to do those things, they're gonna have to do them anyway. And if a person doesn't have a safe place to sleep, they're gonna have to sleep in a public place. And that is not a right that can be denied. So these bylaws across Canada really function as part of that same policing apparatus that is perpetuating and enabling anti-Black and anti-Indigenous racism. They're part of that same whole kind of complex of laws and policies that criminalize and regulate certain groups of people and target and profile and stigmatize certain groups of people. And I think I'd be remiss if I didn't add the issues that people using drugs are facing in that regard as well.
Thanks, Emily. I know it was before my time when I was working with the City of Vancouver, but when they were advocating for public washrooms, a couple of my old coworkers, they actually had to go around and count how many poops they found in order to actually, you know, recommend that we have public washrooms for some of our homeless clients. So it's things like that that actually, you know, get things done because we ended up getting public washrooms. But thanks for bringing that up. So we have another question from Mark Richardson. So the city's new modular housing supportive housing pilot program faced a lot of public blowback for the first 2 sites / 100 units this summer. The city needs to deliver approximately 18 more of these 50-unit modular housing projects in 2020 and 2021 before the start of the next election cycle. How can supporters of these programs coordinate their resources / attention to preempt the active NIMBY voices in every neighborhood?
Thank you, Mark. I think that's a really important question, and I can speak to that directly from experience because one of those sites is located in my neighborhood. And I work with a residents group that is trying to advocate for equitable and inclusive development in our neighborhood. And so we came out in support of that modular housing plan. We were really delighted to see, in our view, that's exactly how public land and surplus city land should be used to create 100% deeply affordable nonprofit housing. And all too often, that's not what happens. And we were really dismayed and surprised to hear and see just how well organized the voices against that project were. And so I really think it is very, very important for everyone to take the opportunity to speak up in support of things that we want to see. And by the same token, I think it is very important as well for the city and particularly for councillors to keep in mind to hear all voices and all needs in their wards equitably. And, you know, I think that there's a problem with our current planning processes and public consultation processes in that they just traditionally have failed to engage lower income people, people who are racialized, people who aren't Canadian born, people who speak English as a second language, young people, renters, all the groups who would stand to benefit from the development of affordable housing are not the people who come out to these public consultations that get held. And who tends to show up is people who look a lot like me, white, middle-aged homeowners who have some equity to protect. And their voices end up carrying a great deal of power and weight. So there's also something wrong with that picture. And I think there are things the city too can do to make sure that the voices of the people who would support and benefit from affordable housing are also sought out and have the opportunity to have that influence on public policy.
If I can just add, I don't have a solution, but in the past, I work in Parkdale, and when there was housing being built in Parkdale, there was an uproar in the community of NIMBYism, and what we did at that time was have people there was a group called Park Ambassadors, and they were going around the community and explaining the need of the units. And what they found was a lot of people have a lot of stigma and not a lot of understanding around the people that are going to be living in those units. And I think, as I said, I don't have an answer, but maybe my role would be to get more people involved in these town halls, as Emily was saying, and looking forward and making sure that we're there to share that our experiences and to share the importance and break down that misunderstanding. So that's one thing I can take on, and not the whole thing, but I mean as moving forward to ensure that we are at those sessions.
And then in terms of getting the city involved in like outreach, like how do you propose we push for that, right? There's one thing that we can, you know, state we would like to be at the table, we would like people to be at the table, but how do we actually get the city to agree? A little more specific question, but.
I can answer that in terms of the city. I have to say, like, Working for Change has been around for over 25 years, and we have been in a lot of initiatives with the city. Currently, right now, well, it stopped because of COVID, but we were in the process of training peer people to go into 7 city shelters. We are training, you know, to understand the 12 weeks of training to be able to work in the shelters, and we were going to provide training for the shelter staff as well, which is something that's pretty new. And I feel that the city, like, I don't have an answer. I feel the city is aware of these organizations. I really do. And I think if they're willing to step out of their comfort zone in a way, we can be found. But hopefully we have more initiatives like that so they can know who's around.
For sure, for sure. Thanks for that.
I want to give some credit where it's due, and to someone who I think is actually here tonight, Valessa from the Housing Secretariat of the city. When the Housing Secretariat was developing Toronto's 10-year housing and homelessness plan, instead of hosting the typical city consultations, which they did do, they had the whole, you know, everybody come to Scarborough Civic Center, everybody come to North York Civic Center at 7 o'clock on a Tuesday night to look at big posters. Like, they did that part, but they also funded grassroots community-based organizations to host their own consultations with their own members. And that was super, super, super effective. They got input from groups who convened themselves. And I think that was a really key learning that the city can build on. It takes infrastructure. It takes a pre-existing kind of support system for people to have input. And it takes effort, it takes staffing, it takes a physical space or technology. You know, if we all have the benefit of being able to meet in person, it usually takes some food. And if you can make it possible for groups that are really super local, and groups that directly represent and are by, for, and with people who are normally excluded from these discussions, and sustain the existence and ongoing work of those groups, then they're there to support things like the city consultation. And I think that's a really powerful example of that working well and being done well.
Yeah, and I just thought of LEAP, Lived Experience Advisory Panels. There are city people with lived experience panels already, and it's how do we provide funding so that they can have access to internet, computers, so that they can be in these talks as well, because they used to meet in person. And so training around technical equipment and having access to them is important.
Great, thanks. There's actually a question that was posed by Kamo and it was glossed over, so that was my fault. But the question is, what specific legislation has contributed to a rise in precarious housing?
Do you want me to start? I can.
Well, I can start because it's very brief. I just know that social housing, the last social housing was a bunch of co-ops that was built in 92, I think. My daughter's was born like 93, so I know 92. And so having a housing strategy and providing more housing. But I think I will let Emily answer this, but I think the stop of that and putting it to the city, it was detrimental because we need a federal government involved, right?
Totally. I was going to start it there too. Back in 1993, when the federal government so-called got out of the housing business, which meant it stopped funding social and nonprofit housing and just basically kind of left the fate of tenants to the private market and left Canada's housing system completely to the private for-profit market. Other key moments, vacancy decontrol. In the late 1990s, the Harris government of Ontario made it so that landlords can raise the rent an unlimited amount in between tenants, as I was mentioning earlier. That's had a huge impact on rent levels in Ontario, and we can now track the huge difference between jurisdictions where there is some kind of vacancy control and the way that rents kind of stay pretty steady over time, or they increase, of course, but they increase in line with the increases in the cost of living and increases in people's incomes. Whereas in jurisdictions like Toronto, where there's vacancy decontrol, you see this very sharp curve where rents just spike up. That's contributed to enormous precarity and has led to the loss of, a recent tally put it at 322,000 affordable units have been lost across Canada just in the period between the 2011 and the 2016 census. And so that's just one 5-year period that they were able to get statistics for. during which units that were affordable to households earning less than $30,000 went down by 322,000. And then there's other pieces as well, right? The failure to have social assistance rates and disability rates that reflect the cost of living. It's shameful that, you know, even in a moment where the federal government recognizes that, you know, sir, the magic $2,000, that's the minimum that people should be expected to live on. Plus they let people earn another $1,000. So they're really saying $3,000 is the minimum people should be expected to live on. And yet folks on ODSP are expected to survive on $1,300 a month. Folks on welfare expected to survive on even less than that. And I don't know the current number. You know, so those are all policy decisions that have contributed to precarious housing and homelessness. And you can track the increase in homelessness in Ontario and in Canada and in Toronto right against those moments in time and those changes over time.
And what I wouldn't mind looking at too is with our organization, we have funding from Toronto Employment Social Services. So there are incentives for people with on Ontario Works looking for work and their support, but people on ODSP as with disability do not have those incentives, but yet they're evaluating each case and might, you know, take people off their assistance. So looking at incentives for people on assistance that's valued and needed, and also what I wanted to touch on was zoning. Zoning is something that it comes up a lot. I understand from my understanding that there's, you know, only certain areas in Toronto that you can have boarding homes or roommate people with different rooms, and like in Scarborough, you can't have that unless you live with someone. I'm seeing a lot of single people, especially younger people, you know, and single people having to live with strangers in order to afford housing. So if they could have you know, buildings separated in terms of more affordability and have more units, you know, rooms within them.
Yeah, and that's something the city has control over and is actually looking at right now and has been looking at for a long time. Is you know, that it makes no sense that rooming houses are allowed in some parts of the city and considered to be illegal in others. I noticed that Nina has given us all the information about ODSP and OW rates, so I just want to say thank you for that. So $700 for folks on OW.
Yeah. And thank you to some of the other folks who have also been answering some of the questions throughout the chat. I actually just have a question. So over the last couple of weeks, I've gone back and I've started working frontline homeless outreach again. And what I've been noticing is that some of our clients who are clearly ineligible for CERB, and for those of you who don't know, to apply for CERB, very, very easy. It's 3 questions essentially that you just have to say yes, yes, yes. And unfortunately, what I'm noticing is that a handful of folks who are homeless are now receiving CERB. So what do you propose will be the outcome of this?
I don't know, but the only experience I have with that, as I mentioned, through our funding through Toronto Test and Toronto Employment Services, I've been able to reach out to people because normally after leadership programs, I am able to support people up to 6 months in terms of getting them employment. And because of the shutdown in March, I wasn't able to do that with our last group. So bringing in this wraparound services program through Zoom, I decided to connect with people that didn't get that service, but a lot of them were on CERB and no longer on Ontario Work. So that that stopped them from getting the access to those other incentives. So that's the only experience I have with that. Emily, I don't know if you can answer.
I've definitely heard other people raising that concern. And I think there's a few things to keep in mind. One is that not so much people who were on OW, but certainly lots of people on ODSP actually could qualify for CERB, because a lot of people are on ODSP and work. And if they had a loss of employment and a loss of income over a certain amount, and had earned, I think it's $5,000 in the previous year through employment, they could qualify. So there's people who are legitimately receiving it. I think the other piece is that the ease with which people could access CERB, the dignity of CERB, right? That it didn't put people through the ringer. What people have to go through to get ODSP is completely ridiculous. And it's like a marathon, you know, and people have to reapply and jump through hoops and go through the first and second denial and keep appealing and appealing just to get it. And the comparison with CERB and how we can all see the importance of having income available in times of crisis, and of responsive income, something that actually fills the gap for people, I really hope is going to be a model for much better income stability programs. I know a lot of people are talking right now about universal basic income, and I do think it's one of those things that there's as many different definitions or ideas of what that means as there are people advocating for it. And I think some things, you know, for us to keep in mind are the, you know, questions around how a universal basic income functions in a capitalist market-based economy. And if we're talking about a universal basic income, but then saying to people, okay, just go to the private market, you've got the cash, now you're on your own, go to the private market to purchase everything you need. I don't personally think that that is going to lead to the kind of equity and justice that, that we're looking for. But on the other hand, a universal basic income model that understands and works in concert with social provision of things like housing, health, food, education, and other social goods. I think that really needs to be looked at, and that the dignity aspect is really key to consider. I don't know anybody who felt ashamed of being on CERB, or who was made to feel ashamed of being on CERB. Whereas people who are receiving ODSP and OW are stigmatized and discriminated against all the time on the basis of their source of income.
Yeah, thank you for bringing that up. I know I've worked with folks trying to get them on welfare for months, and the amount of documentation that we would have to get and the hoops we would have to jump through was, I mean, it was hard work for me, but it was even worse for the client, you know? So yeah, thank you for bringing that up. And I'll just check over if we have any other questions. I think that's good. So
there was a question about accessibility. And you know, I think taking us back to thinking about if this is our new normal in terms of how we're going to have meetings and how the city is going to do its public consultations, then accessibility really needs to be seriously considered. I think this is Jeffrey. I see you nodding, Jeffrey. In terms of ASL interpretation, subtitling, translation, the types of things that now the city has gotten really good at incorporating into its, you know, public consultations and stuff. There have to be ways to incorporate that into these new virtual meetings, not to mention the accessibility of the technology for people to participate.
Mm-hmm. Well, I remember even at the beginning with Doug Ford in those meetings, there was no accessibility involved. There was no one signing, right? Which for me, I was like, this is extremely surprising. But yeah, it just goes to show. So, all right. But Emily and Dawnmarie, do you have anything else to add before we wrap up?
No, I am just actually really extremely happy to be involved in the call and to learn as well. I'm speaking from my experience, but also a little bit of the community. But I've actually learned quite a lot here, so I'm happy. Thank you.
Yeah, thank you all so much for hosting this conversation. I think it's really important, and I think this is one of the weird benefits of this time is the ease with which we can all kind of come together and have these conversations. So I really appreciate that you've made that possible, and I just hope that everybody who took the time to be here tonight is also able to find one action you can take in the coming days, just to make your voice heard and make it known to elected representatives or to whoever what needs to happen, or even just to take action to meet our needs and our neighbors' needs without needing to put the state in the middle of that interaction.
Awesome. So yeah, although it can feel, like an uphill battle for many of us working in homelessness services or even conducting research in the field, we do want to maintain that importance of remaining positive and hopeful during these unprecedented times. And you both did a lovely job at conveying that. So thank you so much again for taking the time out of your busy schedule and for being with us tonight. So, and thank you to everyone else for showing up.
Thanks, everyone. Thanks for the great questions.
Yes. Take care.